Hello everyone, welcome to my channel. Before we dive into today's topic, I want to remind you that the information provided in this video is for educational purposes only. It is not intended as medical advice. Please consult with a healthcare professional for medical advice, diagnosis, or treatment. Today we are going to talk about catatonia, a complex and often misunderstood condition. Let's start with the basics. Catatonia is defined as a behavioral syndrome characterized by an inability to move normally despite having the physical capacity to do so. It can manifest as lack of movement, excessive movement, or abnormal movements and behaviors. The core deficits of catatonia include motor immobility, excessive motor activity, extreme negativism, mutism, peculiarities of voluntary movement, echolalia, and echopraxia. Catatonia is not as rare as once thought. It affects approximately 10% of acutely ill psychiatric patients, particularly inpatients is what is the 10% referring to. It can occur in various psychiatric and medical conditions, including mood disorders, schizophrenia, and neurological disorders. The pathogenesis of catatonia involves both genetic and non-genetic factors. The genetic predispositions can play a role, but environmental factors such as stress or trauma can also trigger the condition. Evaluating catatonia involves a thorough clinical assessment, including a detailed history and physical exam. The Bush-Francis Catatonia Rating Scale is often used to assess the severity and presence of catatonic symptoms. Additionally, diagnostic tools may include laboratory tests to rule out metabolic or infectious causes, neuroimaging to identify structural brain abnormalities, electroencephalography EEG to detect any underlying seizure activity. It also is important to assess for any underlying psychiatric or medical conditions that may be contributing to catatonic state. The lab tests play a crucial role in evaluation of catatonia. These tests can help identify any underlying medical conditions that may be contributing to the symptoms. Common lab tests include CBC, complete blood count, to check for infections or hematological abnormalities, electrolyte panel, to identify any imbalances that could affect neurological function, liver function test, to assess for hepatic encephalopathy, thyroid function test to rule out thyroid disorders, toxicology screen to detect any substances that might be causing or exacerbating catatonic symptoms, autoimmune panel to identify autoimmune encephalitis or other autoimmune conditions, creatine kinase levels to check for muscle damage due to prolonged immobility. The non-pharmacological, which means non-medication based treatments for catatonia include supportive care, ensuring a safe environment, and addressing any underlying medical conditions. ECT, which is electroconvulsive therapy, is also highly effective for severe cases. As for the pharmacological treatment, which is medication-based treatments, these include benzodiazepines, which are the first-line treatment. Lorazepam, also called Ativan, is commonly used and can be administered both intravenously or orally. If there is no response to benzodiazepines such as Ativan, lorazepam, Valium, and other medications, medications such as antipsychotics or mood stabilizers may be considered depending on the underlying condition, if it's mood-based or if it's psychosis-based catatonia. In cases of malignant catatonia, which is a life-threatening form, immediate treatment with high-dose benzodiazepines or ECT is crucial. Additionally, for catatonia associated with anti-NMDA receptor encephalitis, treatment may include immunotherapy such as steroids, intravenous immunoglobulin (IVIG), or plasma exchange. To conclude, understanding catatonia is crucial for effective treatment and management. If you found this video helpful, please like, share, and subscribe for more medical insights. Thank you for watching.